Hello everyone, how are you all? My today's topic is mental health nursing. 1. Demonstrate an awareness and acceptance of mental health and illness as legitimate health issues. 2. Describe the nursing process as applied to mental health nursing. 3. Utilize knowledge base to actively participate in therapeutic milieu for clients with mental health problems. 4. Explore factors affecting mental health, especially in the Pakistani culture. 5. Demonstrate care of a client suffering from different mental health illnesses. 6. Identify need and relevance of community mental health in Pakistan and the resources available to manage it. The subject we are going to start today is mental health nursing. First, when we talk about mental health nursing, we understand that it deals with mental issues, psychological problems, and all types of brain-related problems. We will study all of these in this subject. Depression, anxiety, suicide, schizophrenia, and many other conditions. Mental health. WHO 2007. Mental health is not just absence of mental disorder. Right arrow, you can have no diagnosis but still not be mentally healthy. Example: a person with no illness but always stressed, angry, and isolated. Who defines it as a state of well-being with 4 parts. 1. Realize his own potential, know your abilities, and use them. Example: a BSN student who believes, I can pass and become a good nurse. 2. Cope with normal stresses of life, face problems like exams, money, family issues without collapsing. Example: feeling anxious before exam but still studying and managing. 3. Work productively and fruitfully, be able to study, work, and be useful. Example: a nurse doing duty, caring for patients effectively. 4. Make contribution to community, be part of family, friends, society, help others. Example: volunteering, supporting family, being a good team member. And people usually have a lot of misconceptions about these illnesses. So first we will talk about the myths, the wrong beliefs people have in their minds. For example, the first one, mental illness is caused by evil spirits and supernatural powers. What do we mean by that? People say someone gave an evil eye, someone did black magic, someone mixed something in water and made them drink it or cast a spell. People create all kinds of stories. Someone did jadoo on them, so according to people, supernatural power, evil eye, and such things affect the brain. And because of that, people go insane or their mental health. So if we keep thinking that someone gave us the evil eye, someone did a charm, someone did something to us, and that's why we are having mental problems, then yes, it will affect us that way. But as a medical student, as a medical professional, as a healthcare professional, when you study these things, you have to think differently from these myths and from common people, because it is our responsibility to take care of a patient, to bring them towards stability and health, and to help resolve their mental problems. Think from a scientific, rational, evidence-based perspective. Think about how we will treat the patient, and what the internal causes of the problem could be. We are not concerned with external superstitions. Introduction of mental health. Detailed explanation. Mental health is about how we think, feel, and act. It determines how we handle stress, how we relate to other people, and how we make choices in daily life. Just like physical health is about your body, mental health is about your mind and emotions. Example: 2 students have the same exam tomorrow. Student A feels nervous but makes a study plan and sleeps. Student B panics, thinks, I will fail, can't sleep, and cries. Both have the same stress. But student A has better mental health coping skills. 2. Key areas mental health affects. The slide says it affects thoughts, feelings, and actions. Let's break it down. A. Thoughts, cognition. This is how you think and perceive things. Good mental health. This is difficult but I can learn it. Poor mental health. I am stupid. I will never understand this. Example: a nurse makes one medication error. Healthy thought: I made a mistake. I will double check next time and report it. Unhealthy thought: I am a failure. I should quit nursing. B. Feelings, emotions. This is how you feel about yourself and others. Good mental health. Feeling sad when something bad happens but recovering. Poor mental health. Feeling hopeless, worthless, or angry all the time with no reason. Example: patient gets bad news. Healthy: feels sad for 2 days, talks to family, starts coping. Unhealthy: stays in bed for 2 weeks, stops eating, says there's no point in living. C. Actions, behavior. This is how you behave and handle life. Good mental health. Can go to work, maintain relationships, solve problems. Poor mental health. Withdrawing from people, unable to work, using drugs/alcohol to cope. Example: a nurse working 12-hour shifts. Healthy: takes breaks, talks to colleagues, does exercise after shift. Unhealthy, skips meals, isolates, starts yelling at patients. Relationships, real-life example. Aisha is a BSN student. She has assignments plus clinical plus family problems, but she makes a timetable, asks friends for help, prays, and sleeps 6 hours. She feels stressed but in control. That's good mental health. When to get urgent medical care, the slide says. If you have trouble managing common difficulties, this does not mean every bad day equals mental illness. It means when normal problems become too big to handle alone. Red flags/warning signs. 1. Can't sleep or sleep too much for 2+ weeks. 2. Can't go to class/work for many days. 3. Thoughts of hurting yourself or suicide. 4. Using alcohol/drugs to cope daily. 5. Extreme mood swings that affect safety. 6. Hallucinations, hearing/seeing things others don't. Example, Ahmed failed 1 quiz. He feels sad for 2 days. Normal. Ahmed failed 1 quiz. He stops eating, stops attending clinical, and writes, "I'm better off dead." That's when urgent medical/psychiatric care is needed. Why this matters for mental health nurses. As a mental health nurse, your job is to 1. Assess, is this normal stress or a mental health condition? 2. Educate, teach patients that asking for help is strength, not weakness. 3. Intervene, provide therapeutic communication, support, and refer to psychiatrists. 1. Myth, mental health problems are only seen in illiterate, poor people. Mental illness has nothing to do with education or income. It's caused by a mix of genetics, brain chemistry, trauma, stress, and biological. Example. 1. A MBBS doctor with 10 years experience develops burnout and depression due to long shifts. 2. A 20-year-old BSN student from a rich family develops anxiety and panic attacks before exams. 3. A daily wage worker develops depression after losing his job. All 3 have mental health issues despite different backgrounds. Nurses' role, educate community that mental illness doesn't choose based on status. 2. Myth, people with illness can never be productive or do normal work like normal people. This is stigma. With proper treatment, therapy, and support, people with mental illness can live normal, productive lives. Example 1. A nurse with OCD takes medication plus therapy and works in ICU successfully. 2. A teacher with bipolar disorder uses mood stabilizers and teaches full-time. 3. A famous author with depression writes books and gives lectures. Productivity depends on treatment and support, not the diagnosis. Nurses' role, encourage adherence to treatment and workplace accommodations. 3. Myth, once a psychiatric patient, always a psychiatric patient. Detailed explanation. Many people think psychiatric diagnosis equals permanent label, but mental health is on a spectrum and many conditions are episodic. Example. 1. A woman has postpartum depression for 4 months. With therapy and meds she recovers and never relapses. 2. A student has exam-related anxiety in Sem 1. After learning coping skills, he's fine in Sem 6. 3. Someone with schizophrenia may have 1 episode in their 20s and with treatment live independently for 30 years. 4. Myth, children don't suffer from psychiatric illnesses. Detailed explanation. People assume kids are too young to have mental health problems, but the brain develops in childhood and stress/trauma/genetics affect kids too. Example. 1. ADHD. 8-year-old boy can't sit in class, forgets homework, but is very bright. 2. Anxiety. 10-year-old girl gets stomachaches before school due to separation anxiety. 3. Depression. 14-year-old teen withdraws, stops playing, says nothing is fun anymore. Early identification equals better outcomes. Nurses' role, screen children in schools/clinics. Teach parents that tantrums versus disorder are different. 5. Myth, mental illnesses are contagious. Detailed explanation. This comes from fear and lack of knowledge. People think if they talk to a depressed person, they will catch it. Example 1. A nurse cares for 20 patients with depression. She does not get depression from them. 2. A family lives with a member who has anxiety. Other members don't catch it, though they may feel stressed. What can spread is stigma, misinformation, and stress, not the illness itself. Nurses' role, correct this myth in wards, promote therapeutic communication without fear. 6. Myth, mentally ill patients are violent and dangerous. Detailed explanation. Media shows 1 violent case and labels all mentally ill as dangerous. This is the biggest stigma. Example 1. A man with schizophrenia lives quietly, works in a shop, and has never hurt anyone. 2. Most hospital violence comes from intoxication or frustration, not from diagnosis alone. 3. A person with depression is more likely to harm themselves than others. Nurses' role: assess risk individually. Don't assume danger. Use therapeutic rapport to keep both patient and staff safe. Old beliefs about mental illness. For centuries, people didn't have medical knowledge about mental disorders. So they explained it with religion, magic, and myths. 1. Religious cause right arrow punishment by God or not following rituals. 2. Supernatural cause right arrow evil spirits, jinn, or black magic. 3. Myth cause right arrow the moon affects the mind. That's why we still say lunatic. These beliefs still exist in many communities, including Pakistan. As nurses, we must respect these views but also teach that mental illness has medical, psychological, and social causes that can be treated. These three terms are often confused. 1. Psychology right arrow, the study science of the mind, studies how people think, feel, and behave normally. Example, research, testing, counseling. 2. Psychotherapy right arrow, the treatment talk therapy to treat mental/emotional problems. No medicines. Example, counseling, CBT for depression/anxiety. 3. Psychoanalysis right arrow, a type of psychotherapy deep talk therapy to explore unconscious mind, childhood dreams. Example, Freud's method. Long-term therapy. Mental illness is when a person's response to stress causes problems in their thinking, feelings, and behavior. The response is 1. Not suitable for handling the stress. 2. Different from what their culture/society considers normal. 3. Interferes with their work, social life, or physical health. Mental illness is not just feeling sad or being different. It's a condition where stress leads to thoughts, feelings, and actions that are culturally inappropriate and make it hard for a person to function in daily life. As nurses, our role is to identify these maladaptive responses early and help the patient develop healthier coping so they can function normally in society. Disorders of the mind have complicated causes. Usually it's not just one reason. It's a mix of biology plus environment plus physical factors. 1. Heredity/genetics. What it means. Some mental disorders run in families because of genes and brain chemistry. How it works: if your parents or close relatives had a disorder, your risk goes up. But having the gene doesn't mean you will get it. Examples: schizophrenia. Risk is higher if a parent or sibling has it. Bipolar disorder and depression, often seen in multiple family members. ADHD. Strong genetic link in children. Nursing point: take good family history during assessment. 2. Environmental stress. What it means. External situations and life events that put pressure on the mind. How it works. Long-term stress can trigger disorders, especially in people who are already vulnerable. Examples: trauma, abuse, accident, war, losing a loved one. Right arrow PTSD, depression. Social factors: poverty, unemployment, bullying, academic pressure. Right arrow anxiety, depression. Physical environment: pollution, overcrowding, natural disasters. Right arrow stress disorders. Cultural factors: stigma, discrimination, migration. Right arrow adjustment disorders. Nursing point: in Karachi, common stressors are financial problems, load shedding, traffic, and family conflicts. 3. Medication. What it means. Some medicines and substances can directly affect brain function and mood. How it works. Side effects: withdrawal or long-term use can cause mental symptoms. Examples: steroids like prednisolone. Right arrow mood swings, anxiety, psychosis, drug abuse. Cannabis, ice, heroin. Right arrow psychosis, depression, anxiety, alcohol. Right arrow depression. Memory problems, withdrawal from sleeping pills or painkillers. Right arrow irritability, anxiety, hallucinations. Nursing point: always check medication history and substance use. 4. Damage to the brain. What it means. Any physical injury or disease affecting the brain can change behavior and thinking. How it works. Brain regulates mood, memory, personality. Damage equals mental symptoms. Examples: trauma, head injury from RTA. Right arrow personality changes, aggression. Medical: stroke, brain tumor, epilepsy. Right arrow depression, confusion. Infections: meningitis, encephalitis. Right arrow delirium, cognitive problems, degenerative. Alzheimer's, Parkinson's. Right arrow memory loss, mood changes. Nutritional: severe B12 deficiency. Right arrow depression, confusion. Nursing point: rule out organic causes before labeling it as psychiatric. Important note: most mental disorders must be assessed by a specialist. Why? Because we don't diagnose from one symptom. Example: not sleeping equals could be anxiety, depression, mania, thyroid problem, or medication side effect. A psychiatrist/psychologist looks at the group of symptoms plus duration plus impact to make a diagnosis and plan. Childhood and puberty are key times for brain development. Stress, genetics, and environment during this time can affect how the brain grows. If ignored, these patterns become long-term. 1. Attention Deficit Hyperactivity Disorder, ADHD, a neurodevelopmental disorder with problems in attention, hyperactivity, and impulse control. Signs: can't sit still in class, forgets homework, loses things, interrupts others, acts without thinking. Example: a 8-year-old boy in Karachi who is very bright but fails exams because he can't focus for more than 5 minutes and keeps disturbing class. If untreated, leads to low self-esteem, poor academic performance, risk-taking in teens. 2. Autism Spectrum Disorder, ASD, what it is: a disorder that affects communication, social interaction, and behavior. Spectrum means symptoms vary from mild to severe. Signs: doesn't make eye contact, trouble understanding emotions of others, repetitive actions like hand flapping, strict routines. Example: a 4-year-old girl who doesn't respond to her name, prefers to play alone, and gets very upset if her toys are moved. If untreated, social isolation, difficulty in school and jobs later. 3. Generalized Anxiety Disorder, GAD, what it is: excessive, uncontrollable worry about everyday things for 6+ months. Signs in kids: constant what-if questions, stomach aches, headaches before school, trouble sleeping, restlessness, irritability. Example: a 12-year-old who worries all day about grades, parents' health, and what friends think. Cries before tests even after studying. If untreated, can lead to depression, panic attacks.